February is NICU Awareness Month, so what better time to discuss what that might mean for a breastfeeding and pumping mom who may be dealing with a baby in the NICU. In many cases, a baby will spend time in the NICU due to prematurity. Developmental growth plays a big part in their ability to latch on and know what to do when they are trying to breastfeed. Their size and the time away from the mom will pose problems and complications when trying to breastfeed. Other problems that would lead to time in the NICU will also pose similar risks, as well as things that will be attached to them, such as feeding tubes, ventilators, and more. For these reasons, a mom may choose to hand express and pump. A pump will need to be of a hospital grade in order to keep up with the level of volume needed. You're going to be pumping as often as a baby would feed. This can mean every 1 to 2 hours in the beginning to every 2 to 3 hours on average. Research has shown time and time again that if a baby can receive breast milk, their time in the NICU is dramatically shortened because it is not only helping them grow faster with higher protein content in the beginning, but also immune factors that are helping them stay healthy and avoid infections and viral problems while in the NICU and in a hospital setting. For this reason, moms will need help not only expressing and pumping milk, but protecting and maintaining her supply due to the separation of time spent in the NICU. Other tools that may be needed: nipple shields, SNS or supplemental nursing systems, different types of pumps, maybe a silicone pump for priming before actually sitting down for a full pumping session, as well as talking with an BCLC what about a pumping schedule looks like. Cup feeding, suck training, all of these things may be needed with your baby, especially if they're premature. You can also get resources from a speech and language pathologist, as they can help with tongue development and tongue strengthening if they've not had that practice prior to. A very important tool that you can utilize is called kangaroo care. It's basically a fancy form of skin-on-skin contact in which you're keeping baby close to the chest, and this encourages them to not only root around, but it actually regulates their body temperature and blood pressure. For more in-depth discussion on breastfeeding for NICU and preemie babies, visit motifmedical.com/blogs. Thank you for watching.